Hi everybody, Chris Bailey here with Physical Therapy and Balance Centers. I'm going to be going over one of my favorite areas today, and that's the balance system. So I'm going to be going over common anatomy, common problems, and some common treatments for this area. So when I talk about the balance system, it's really kind of complex, but I'm going to simplify it into three main things. So three parts of the balance system that we have are our sensation, and that's basically the ability for us to feel the floor with our feet, feel our ankles move. All that information goes to our brain for that system to process. The second part of the system is our visual system, and for balance, primarily what we do is we use our eyes for depth perception. So I can tell how far away the camera is right now. When I close my eyes and take that away, I'm not sure how far I am, and I can't use that for depth perception, so I tend to sway a little bit more, and so do most people. And then the last part, and this is the part that we deal with probably the most, or that's the most intertwined to our treatments, is called the vestibular or the inner ear system. And this system is deep in the inner ear, so this is the right ear here. It's deeper than the ear canal. It's inside of the bone of the inner ear. And inside there you have this little bony structure. And this little thing, you can't see it that well right here, but you have attached to the vestibular system the cochlea, or the hearing part of the inner ear. And in the inner ear system, the vestibular system, you have these three little canals that come up off of this main area and through here. And what these canals do is they tell us when we turn our head side to side, because there's water that flows and hits little nerves at the ends. You also have this little sensation system in through here at the bottom where these crystals are attached, which these crystals are identified by these little blue stars. But what they do is they tell us when we stop and when we go. So this inner ear system is always firing. It has connections with the eyes to help our eyes to stabilize when we turn our head. So some folks have trouble when they turn quickly, their vision gets blurred, and that's primarily due to a weakness of the inner ear. Some people have trouble standing still or walking in darkness, or when they aren't able to use their eyes, because when you walk in darkness you have to rely a lot on this inner ear system. So when you walk in the dark and you feel off balance, or when you close your eyes and you feel off balance, this system can get weak. It can just get weak over time, like our muscles when we aren't up and moving quite as much as normal. Like figure skaters really train the system to be able to twirl, twirl, twirl and not get dizzy. We can retrain the system to get stronger too. One of the main things that we see are people who have what's called positional vertigo. And what that is when you move in a certain direction, like you lay down in bed on your right hand side and it just feels like the whole room is twirling like this, then it tends to go away for most folks after a period of time. Go away in that position, but when they get up and go back to that position, it recurs. So we see a lot of people for that. And what happens is that these crystals break loose in the inner ear. They can do this from trauma. They can do it with certain medications. Most of the time we don't know why they come loose. They just come loose and people come in with this problem. So these crystals go loose and they go in these little canals like this, and this little end of these canals are kind of plugged with, we have a little nerve ending at the end of that there. When these crystals go in that area, they don't belong there, so they send a fake message to our brain that tells us we're moving all the time when we really aren't. So the treatment for this are to do very specific movements to get these crystals out. We have a set of really specific goggles that are infrared goggles that actually look at your eyes, and based on how your eyes move, we can tell if these crystals are in the front canal, in the middle canal, or in the back canal. And when I tell people, it's kind of like Labyrinth is what we do. That game where you used to roll the marble around in a little contraption trying to miss little holes. So if we know that it's in this one canal, we can move your head in a certain way. For instance, if I take this off of here, if it's in this middle canal here, what I can do is lay you back quickly. So when I lay somebody back quickly, basically the crystals go to this other position down here because gravity just allows it to pull down like that. And then what we do is change positions quickly to go to a position more like this, so the crystal moves more in through this area. And the idea is to get it back where it belongs, in through this area. So then when I sit somebody back up, that crystal goes back down into this area called the utricle. It doesn't go back to where it originally came from. It goes down into this little area, almost like a garbage disposal of the inner ear, called an endolymphatic duct. And that duct kind of chews up those crystals, and then you don't have this problem anymore. The problem is this tends to come back over time. So oftentimes there are little movements that we do to help get rid of this problem. Sometimes it's been going on for days, sometimes for weeks. We've seen people for years, And the nice thing is, usually in a couple of treatments, this can be corrected. After this is corrected, what happens sometimes with about half the folks is they still feel unsteady on their feet. And we see a lot of other people that just generally have dizziness. So we have a whole program for them on Active at Home to help improve that stability. If they still seem to have, or you still seem to have trouble with either vertigo or feeling a little bit unsteady on your feet after trying our Balance Active at Home, give us a call for a free balance consultation. We'll put you through a whole process where we use overhead support systems so we can really accurately diagnose, is this the problem? Do you have another issue maybe with a disconnect between the inner ear and the feet, which can happen? And we can identify what that problem is, give you more specific exercises to try out. But give the Active at Home a try. They're our best ones for balance and dizziness. And then let us know if you have any trouble. Thank you.